So I'm here with Dr. Jeffrey Rosenthal, and we're talking about his techniques and how he's done my face. And I thought this would be great to share with you guys. Doctor, tell me, you're telling me about you're explaining off camera, and I thought it would be a great idea to do it on camera so other people could also understand, like I did.
Sure.
The Botox, how you did the Botox in my face, it's different than all the other doctors. Explain why and how does it work?
Sure. Well, Botox, my concept of Botox is not to paralyze the forehead, but to balance the brows and to make the forehead nice and smooth. And so what I do is, first of all, I have to analyze the face, whether it's the forehead or the whole face, and then decide which one is lower or higher and how to balance it. So everyone has one brow a little bit lower than the other. So I have to leave more motion on one side and I have to balance the brows. And what I do is this muscle around the eye itself actually pulls the brow down. So I put some Botox in the brow itself so the brow can come up. I then also, this muscle along here pulls the brow down. So instead of putting little spots in, I put a whole stream so it frees that muscle. And the forehead, I put 20 or 30 little bits of micro Botox into the forehead. And what that does is it allows some motion of the muscle, but more importantly, it smooths out the skin. It looks beautiful because it shrinks down the oil glands. So the combination of micro Botox and balancing the brows makes the forehead and face look beautiful without paralyzing. And that's truly beautiful Botox.
So that's like an art, like your art.
It's an art. Well, my home is filled with art. My office is full of my personal art. I sculpt, draw, paint. I write poetry, children's books. I've had art shows in Europe, art exhibits rather, in Europe, as well as museums here. And every time I work on a body or a face, it's art for me. And so I like to analyze it, and I want to make my patient really, really happy, and I want to be pleased as well. So I work hard to do that.
Yeah. I that was the best thing I ever heard, I think, was the micro Botox that you do closes the glands, the oil, because I
Yes,
have very oily skin,
yes.
and when you said that, I was in heaven.
Yeah, no, the forehead will look smooth and just the luxurious, the skin will look so much better. Likewise, when I put fillers under the skin, it stimulates collagen. And
Right.
by stimulating collagen, the skin glows and has a really nice look to it as well as a contour. So when you do a face, again, you have to analyze which cheek is higher and lower because every face is a little
Right.
asymmetrical. So by drawing a map first on the face, a topographical map, and then injecting it with certain techniques that it's painless, but also leaves less bruising and sculpts the face, then I mold it afterwards with my hands so that the facial contour is natural. I also use a whole combination of Radius, Restylane, Voluma, different fillers that I dilute and use blunt needles so it's not painful, so I can shape and contour the entire face and jawline and make it look really lovely.
Nice. Well, I gotta share my experience. That's why I'm actually filming him. But I don't want to show my face right now because it's still swollen. But you guys
You
have to
look great.
wait. He says, what, 5 days?
Yeah,
Then you see the face. My biggest concern about, fillers and Botox, I was really afraid my whole life because I didn't want to look like a clown. I didn't want to change my face. I just said, enhance what I have. And that's exactly what he did. I am already in love with the way it is, but it is a little swollen, and so I don't have much makeup on, and I want to make sure when I show you guys, you be blown off your mind because it does look really good already, and I cannot wait for 5 days to have the just final result. But my biggest concern was I didn't want to look like I had have been bitten by a bee, or I didn't want to look like a clown, I changed because a lot of the doctors they just do change their people's face, and I don't like that. So the way I'm looking right now, it's just fabulous. He did just enhance what I had already and make it better, right? That's the whole point, I think.
that's the art of what I do, and that's why it takes me so long to do each face. I never rush through any procedure. I do one at a time, and everyone has to be individualized, and you have to maintain their identity, just enhance what they have. And that's the art, And that's the science of what I do. You bring together all these technologies to build it up. The other procedure I'm doing are threads that in addition to the fillers, I can actually lift and contour certain areas of the neck and face. And in combination with the fillers, it just gives a really natural, lovely, lifted, contoured face. It's just gorgeous.
Well, I guess this is gonna be for the next time. But for me, it was you did my jawline, right? You did. Tell what you did in my face.
Well, we did. We put some in the angle over here to make the jawline more symmetrical and build up the corners. Also, in the jaw where everyone loses some of that nice smooth contour, we filled some here. In the cheek area, with a blunt cannula, I was able to contour and fill this whole area and give an arch. So that there's an arch and then a nice contour below that, and filled some of the hollows over here. And then with another instrument was able to put more filler, a different filler, different layers of filler, different types that do different things, lift and contour. So the combination of fillers helps to fill the face. And then the lip is another specific product that can fill not only the lower pink part, but where it joins with the skin, and then rebuild the Cupid's bow and also these pillars, and make it so that there's a little pout here, here, and here, and then the lower lip conforms to the upper lip. So it's natural and not pouting and not turned up like a fish.
Right.
It's supposed to look really pretty and natural, and that's the object of doing lips, which are not easy to do, but the results are just gorgeous.
And that was my fear, I told you. Well, first, I want to share that I have a very asymmetrical face. And I'm only able, oops, my camera moved a little bit. I'm only able to notice that in pictures. So I was sharing it with the doctor. I said, my lips are, one side smaller than the other. My eyebrow, as he noticed right away, most people don't notice, but I do, and he did it because he's an artist, one is much higher than the other. So he fixed all of that. The eyebrows, it's the results. You said it takes, 4 or 5, how many days?
You'll start seeing a result in 3 or 4 days, but the first time I do the micro Botox and balance it, it may take 7 to 10 days for it to fully work the first time. And the second time I do someone, it works faster. Botox lasts about 3.5 to 4 months on average, but the smoothness that you get from the glands lasts even longer. So even when the muscle movement starts coming back, patients notice that the forehead looks so smooth and they say, oh, it's still working. Well, it is working. It's working on the glands that have just shrunk up.
Right.
That's what you're seeing.
I cannot wait for that to happen. And one more thing that we talked about, my big concern, like I said, to look different or to look like a clown. You just explained the lips, because I also had no Cupid bow, and I always made that with makeup. And a lot of people, for a long time, people would ask me, did you do your lips? I never done my lips, but I used to overdraw them with makeup to make it look like I had a Cupid bow. Now I guess I will have, and I already can tell that I have. It's a big change. I'm already noticing without makeup, now I look like I wanted to look with makeup that I used to do. And one more thing is, I think what people will see when I post this video, I will be able to have the final results already, so you guys will see what I'm saying. But what I love the most is I am looking without makeup like I used to do with makeup. So now I feel like I don't need to wear makeup because I look the same way as when I did with makeup. And that's the beauty of it. I think I am loving my jawline. I'm loving my cheekbones and the structure. Look like a supermodel face now. That's what I like to call. I think you made me look like a supermodel face. And I know it's a little swollen, so that's why I don't want to show it yet. I want to see the final results. But guys, I'm already in love with my face. I mean, you always have to love yourself no matter what. But everybody likes to enhance a little bit. And that's, I think, I never share my age because nobody asks, and it's like a personal thing. But I am not ashamed to say my age. I will be 43 this month, and that was like my gift, I think, or 43rd birthday. And I feel like I'm looking like I was 23 again. Thank you, Dr.
Oh,
Jeffrey.
my pleasure. You look beautiful always. Now, I didn't make you any better because you're beautiful to start with.
Thank you. I appreciate that. Well, the difference I think that I want to also show my, everybody that follows you and whoever is going to see my face later, like you said, you are an artist, and that's, I think, the difference. Right behind you is one of your paintings.
Yes, I have this is a painting of a bullfighting scene and
That's
one of
beautiful.
my sculptures. And as I said, my home,
Everywhere you have, right?
in my home, I have other paintings and copper and stone and everything all over the place. When you come to my office, I designed it, and you'll see the paintings there and sconces that I had hand blown that I designed. It's supposed to be a very calming experience. And in fact, when I do these procedures, part of what I need to do is I have to not only evaluate what the patient really wants, but I want them to be at ease. And the object is to not rush and to breathe with you and to make it a very good experience so that when you finish, not only do you look great, but you come out and say, wow, that was pretty good. That was easy.
Oh, actually, yes, that was my experience because I was petrified, and I asked you if everybody is like that. And I was pretty afraid because I never done it. And when I go to the dentist, I complain a lot because I have a lot of pain and the anesthesia doesn't work too great on me. I was really afraid, and actually, Dr. Jeffrey Rosenthal was amazing because he made me this technique of breathing, and it totally made a difference. I was so relaxed. He kept asking, are you okay? I'm like, yeah. I was so okay that I was almost falling asleep, and I did not feel any pain. I was petrified in the beginning. When I walked in, he was like, are you okay? I'm like, no, I'm nervous and anxious, and I'm really afraid that it's gonna hurt. I'm afraid that I'm gonna look, too different later. And he made me so calm, and it's just a great experience. That's why I had to share with you guys, and I really had to share all of his techniques and this micro Botox thing and all the techniques that he uses as an artist to just, for you guys to know that, yes, a lot of people are still against the Botox and fillers. And I was one of them because I was afraid of how, I was going to look. And I'm actually you guys can trust me 100% when you see my results. So thank you, thank you, thank you forever.
My pleasure. I'm happy that it turned out as well for both of us, because that's the object, to make you happy and to make me happy. And that's what I really put a lot of effort into. Everything I do, if I touch you, it's got to be as best as I can make it, and it's got to be art for me, because that's how I look at everything I touch, as art.
Awesome. Now, just to finish our little talk, I also want you to share I'm remembering what you told me during our conversation.
Yes.
And I'm trying to remember everything and have you say to everybody that is watching as well.
Right.
You did mention that also you are very fit, you work out, you swim.
Yes.
And that is because he's not only he's a plastic surgeon, so he does a lot of faces, body, and 6 to 8 hour surgeries, right?
Yes.
So you're sharing that you have to be in shape.
Yes.
Talk a little bit of
Well, my facial surgeries, which I spend most of my time now, are contouring the face, not just pulling. And so you have to support, lift, and structure everything underneath in many, many layers, and lift it up so it looks natural. Why someone looks windblown is because they're doing very fast surgery and just pulling. Well, I am lifting, sculpting, and supporting, and those take a very, very long time to do. And so what I need to do is I train like an athlete. I eat very, very well. I eat very healthy food, although I do have chocolate chip cookies and some wine. But I eat well, and then I exercise every day. I swim 5 or 6 days a week for 45 minutes to an hour, and I exercise in the morning. I juggle. I do juggling for my eye coordination hand. I have oriental balls that I use for hand coordination. I've also taken specific courses with a famous eye doctor to coordinate my vision. He would train all of the big sports people in the world for this. So I look at it as an athletic endeavor. You don't just go into surgery and just do it, just like a famous athlete just doesn't go in and do basketball or football. He trains every day. And actually, before I even do the surgery or fillers, I've gone through it in my mind what I want to do many, many times. So I have all these procedures that I can choose from, and I have to isolate it and choose the right one for the patient. But then I have to be physically fit so that from the beginning of surgery until the end of surgery, I am not fatigued and I am well. And in fact, when I do my surgeries, I wait around for an hour and a half afterwards in recovery to make sure that the patient is doing well, and only then do I leave. So it's a very long physical, mental day, and you have to be mentally and physically in the very best shape to do it, and that's what I train to do.
That's amazing. Meditation, workout, swim. Yeah, I mean, thank you so much. This is, I think this video will be very useful for a lot of people that have doubts and fears about plastic surgery or fillers. But like we talked, in maybe 20 years, you'll do my facelift. Then you'll spend probably 10 hours because I'm so annoying and picky. But for now, the fillers did it very well, and I am very pleased. I cannot wait to share with you guys. Thank you so much,
My
Dr.
pleasure. Thank
Jeffrey.
you very much.